is going to work. I mean, I think we have to make some decisions just generally about, because here's, like, when you test healthy people, especially, which we're doing now a lot, and you go get tested, and you actually are right, but then the lab gives you results 7 days later, you may have been infected in those 7 days. And so in some ways, a negative can be a false sense of security. So clearly, if anyone develops symptoms, we want to have the ability, to do a test. I think that that's very, very useful. I'm not sure that just saying, hey, test on the first day of school, oh, you're good. It's not like it's an antibody test. I mean, this is a snapshot in time. And as we know, even though I believe that the younger kids in particular, seem to be more resistant to this. The fact is, you're probably going to see different transmission as this stuff goes. But yeah, I think the health has got to be very paramount, and I think working kind of with and I don't think it's going to be uniform throughout the state. I think you'll see different localities approach it in different ways.
Do you have the authority to test children, on site?
Well, I think that's a very good question. I mean, typically, I don't know that we would be able to just force you to take tests. That's why I think if you're symptomatic and you're sick, then that's probably a different question. But I do think that there are probably some issues. I mean, when we do the long-term care testing, we offer it to the residents, but you have some that just don't want to be tested. We do not force to be tested. Now, we do the staff and make them do it, but they're regulated as part of working in these facilities, so it's a little bit different. But I do think that there are significant issues with that, but I think that those are things you're going to have to work out. But clearly, if you're doing it with folks who are symptomatic, then I think it becomes something that's probably going to be easily defensible.
What would you do differently? What would you do differently? And what kind of course corrections do you think need to be made?
Well, look, I think seeing that, I mean, remember, when we were going through this in March and April, a lot of folks were focused on, what is being restricted or shut down or all that. And I think if you look at it, most of the behavior was changing before a lot of that was happening. And I think what we've seen recently as the cases have risen, as it's become more of a center stage issue again, is we're seeing changes in mobility data. We're seeing people do the social distancing. We're seeing folks who are vulnerable making the extra effort. And I think ultimately that is what's going to do it for us. I was in Miami-Dade with Mayor Jimenez and a lot of the local leaders, and they've done they were one of the first counties in the country, I think, to close. They were closed for 2 months. They had a very, I think, measured, dip the toe in the water into phase one. They've had things like facial coverage, different things going on. I mean, they've pretty much done, I think, all the things different people have recommended at different times. And I think it's really going to be turning the corner with focusing on these key behaviors. And that was kind of the message.
Exactly everything that you need to do.
Well, we're working every day. I mean, so if you look at what we're doing, say, with the testing of the long-term care facilities, we didn't have the capacity in March to test every worker. As we got into May, we were expanding it. We knew we were going to finish going through with that. We knew we had the opportunity to really make an impact on that. We're working very hard to be able to support the healthcare system with all these personnel. It's very, very important. That's the number one. I mean, every person I talk to who runs a hospital, it's all about the personnel. They see traffic. They understand what they have to do. First of all, I think a great story is just how good some of the physicians have done compared to what the results were in March, particularly in other parts of the country. I think they've learned a lot. I think that they're using appropriate treatments that have now kind of been developed and tried over the months, and I think the results are better. So obviously, we wish this could just go away. I mean, that's just not how these things work. And so, as people get infected, we hope that people can fight it off and they needing medical attention, much less hospitalization. But if they do, I think that they're in pretty good hands, and I think that you're in much better shape today going into a hospital in the state of Florida than you would have been in March pretty much anywhere in the country. And I think that they've done a really
yesterday we're talking about is that they wanted to see a more unified, urgent message from a statewide approach. They mentioned that some people are getting kind of mixed messages. And we heard it again today from some of the commissioners at the Board of Education, that the education order was confusing to people. Is it a good idea for you to have sort of this, one size doesn't fit all approach? And shouldn't you have more of a consistent?
No, first of all, the message with Miami-Dade is consistent. I'm supporting the county mayor in what he's doing. I'm supporting those municipal mayors. I may not agree with them on everything politically, but this isn't really about politics, or it's not about the typical tit for tat. We have a task at hand. When the mayor calls me, we're there to help, and we support what they're doing. And there should be no that is very. At the same time, the fate of Miami-Dade County does not rest on the fate of Dixie County does. That's just the reality. And so I think it's served us well to recognize the diversity of the state. Now, in terms of the education, I understand the commissioner has done some stuff on that, and I think that's fine. But at the end of the day, these school superintendents have unique constituencies, and it's going to be a collaborative effort, and I don't think it's going to be just the Department of Education. I think they can recommend, but I don't think they can dictate every decision on this. I think if you talk to parents, I think the view is a little more fractured in terms of what should happen with the schools. I think, probably early June, there would probably been overwhelming say go back, because low positivity, low cases, and things were stable. Now, as you've seen, I think there's naturally concern about what does this mean for schools, what does it mean for safety, and I think different parents look at it different ways, and I think that's going to be different in each different school district. You're going to probably have a different breakdown in Broward than you will in some of these other places, and so you need to be able to recognize that it should not be dictated by the Department of Education. I think they can recommend, but ultimately, we want every school district to do best for the kids, for their education, to make sure they have opportunities to and also making sure that the parents have the agency, so that if you have a district that's offering the in-person instruction, which many parents think is very important, if you have parents that aren't comfortable with that they have the ability to opt for distance learning. And so that is what it's got to be. But I can tell you there is going to be differences in how this operates, and actually there should be. Because if you look at Miami-Dade and Wing in terms of their epidemic, although we did straighten out the percent positive, I was talking to Mayor Jimenez, I'm like, you're higher than the numbers I have. So I think we worked that out. So they've been about 20%. They were 16% a couple ago, but they've been about 20%. Obviously, we want to get that down, but that's a different profile than maybe some of the other places who, it's not like nobody has seen coronavirus. Every county has seen it, but it is just different. And so I think that's the approach. I'm hoping that, we really work and can turn the corner of Miami-Dade. I feel like most of the rest of the state, you kind of see a positive trajectory that we can get to. And that one, I think, in Miami-Dade, a lot of the Broward hospitals are people that actually live in Miami-Dade, and they're going to across the county border to be hospitalized there. So let's work understanding that there's a lot of differences and a lot of diversity, and you may see that first day of school look different in say Northwest Florida than you do in Miami-Dade. But quite frankly, I think that's how most Floridians would want it to be. I think that they understand that. But there is a consistent message when it comes to education statewide, and that is parents have the right to choose the appropriate environment for their child. And if they want to opt for distance learning, then they'll absolutely be able to do that, and that option should be provided for them. Thank you.
You gotta go outside for that? Give a speech?
All right, once again, we were listening into that live update with Florida's Governor DeSantis. Now, he said on Friday they're going to be introducing a drive-through coronavirus testing lanes for those symptomatic patients, which will hopefully bring faster, quote, we hope within 72 hours instead of 72 days. So let's take a look at the numbers that we do have currently happening here in the United States. Yesterday, during President Trump's news conference, he said that we've tested more than 45 million Americans. Here we're taking a live look at the Johns Hopkins University map. You can see that they are reporting 3.4 million have been confirmed with COVID-19. Now, of that number, I know that our death toll only continues to rise, and so we do have more than 136,000 who have unfortunately passed away from COVID-19 complications. But hey, one of the good things is we do have more than 1,050,000 who have recovered from COVID-19. Going to head out to get an update with their governor on COVID-19 with their cases in their state.
We know that this has been a trying time for the families of residents in these settings. However, as we've mentioned before, when it comes to some of our state's vulnerable residents, we have had to take extra precautions to save lives. But with these lines in place and with the proper safety protocols in place within these facilities, I'm grateful that families will be able to once again be together. God bless them all. Next, as it was reported yesterday, the list of states from which travelers to New Jersey are being advised to observe a 14-day self-quarantine period has been updated. Minnesota, New Mexico, Ohio, and Wisconsin have all been added. And as Delaware has seen a sustained improvement in its public health metrics, it has been removed from the list. We continue to ask everyone who has been in one of these 22 impacted to practice self-responsibility and good citizenship and comply with our travel advisories. This goes equally whether you are a visitor to our state or a New Jersey resident returning from one of these states. If you've got any question, visit covid19.nj.gov/travel for the complete list of states and to learn whether you should be self-quarantining. And we further urge you to get a coronavirus test to ensure your health and safety and that of those you. We have the capacity to provide tests, more than 240 locations statewide, and again, a link to a searchable list of sites is also available at covid19.nj.gov/travel. Our 14-day self-quarantine advisory for those who have come through a known coronavirus hotspot is there for a reason. We have done tremendous work to make New Jersey a leader in the nationwide effort to mitigate this pandemic, and we cannot have this work undone by anyone who was in a known hotspot and may have unknowingly brought the virus back to New Jersey with them. Our work to bring this pandemic under control here in New Jersey continues, and we simply cannot risk more cases coming in from elsewhere. Today, we are announcing 396 new positive test results, and since March 4th, we've reported a total of 176,278 positive results for coronavirus. The daily positivity rate for tests recorded on July 10 was 2.13%. This keeps us among the lowest positivity rates in the entire country, although, Judy, it's up a hair since yesterday, but it's still among the best in the nation. It speaks to our ability, all of us, to meet needs for testing on a daily basis and also the great personal responsibility that millions of you have taken. Our rate of transmission currently stands at 0.93, that the rate of spread is below 1, and that means it's slowing. Again, a little bit up from the past couple of days. But the only way we can keep both our positivity and our rate of transmission in the green, so to speak, is by taking the precautions that we have across the months. That means, again, social distancing, wearing a face mask whenever you're out in public, washing your hands frequently with soap and water for at least 20 seconds, and staying at home if you exhibit any symptoms of respiratory illness. In our hospitals yesterday, there were 923 patients being treated for